Report is a step in the right direction.
81-year-old Ed Alex walks through his San Jose neighborhood unsure of where each step will land. Ed started losing his sight 6 years ago.
I couldn't understand what was going on. I also noticed that in my driving down the highways, I was looking at signs. The letters were folding together. Like stop, it would be S-T-P, letter would be missing.
Pretty soon, Ed's vision disintegrated into a blurry fog. Now he can only see with his side vision. A big dark blotch is blocking his central vision. Both eyes are affected, making Ed legally blind. Ed's vision loss is the result of a disease which few people can name, but which is the biggest cause of blindness in the industrialized world. It's called macular degeneration. Now, I notice as you're sitting here and we're talking that your head is always to the side.
When I look directly at you, I do see that you have glasses. I don't see your lenses. I don't see your eyes. I don't see your nose. I don't see your mouth.
That's just a blank spot.
It's just blurry. No, it isn't blurry. It just doesn't exist. And if I move my eyes to the side, as you suggested, you clear up because now I'm looking out of the corner of my eye.
So you're getting the visual rays to go past the center of your eye, to the periphery.
And I've developed
and that works.
Yes, it does, and that saved me from a lot of curves.
If you've never heard of macular degeneration, you're not alone. But this devastating eye disease now affects 13 million Americans, more than all other eye diseases combined. Every week, 1 in 3 seniors is diagnosed with MD. And scientists predict a huge wave of Americans, the baby boomer generation, will soon be facing MD. A staggering 30 million boomers may be facing blindness. Despite these mind-numbing numbers, little research is devoted to the cause of or cure for macular degeneration. $314 million federal dollars are devoted to eye research for diseases including cataracts and glaucoma. But only $16 million, less than 5% of that total, is allotted for research into macular degeneration. In plain English, the words macular degeneration refer to the deterioration or degeneration of the macula, the tiny central part of the retina where the most critical vision occurs. For sufferers of MD, the first sign they often notice is straight lines becoming wavy. Many victims feel lost and depressed when they are first diagnosed with MD. They are given little information about the disease, even less about resources to help them cope.
I just kept thinking, what am I going to do? And I was hoping some miracle would happen that, oh, well, you know, this can get cured overnight or something.
After months of depression, Ed decided to take action. He created the Macular Degeneration Foundation, a one-man, one-phone operation in his cramped apartment, supported by his fixed income and some small donations. Ed gets the word out about macular degeneration through an internet website and a newsletter called The Magnifier. He has memorized the keyboard, and the type is enormously enhanced, but he can barely see the screen. Scientists don't know what causes macular degeneration, but they have identified some risk factors, such as smoking, a high-fat diet, and the sun's ultraviolet rays. Some recent studies have also looked at possible ways to slow the progression of the disease. They have looked at antioxidant vitamins, certain foods such as spinach, and the drug interferon. But to date, nothing has been scientifically proven to be effective.
The laser now is just a bright light.
Laser surgery is the one treatment available to MD victims, but it works only for people with the most severe vision loss, and they risk losing all vision with the treatment.
Hello, is Mr. Bill Helm there?
Finding an effective treatment is more than just a day job for ophthalmologist Dr. Robert D'Amato of Harvard. As one of the leading researchers in macular degeneration, Dr. D'Amato has a mission: to unlock the key to the disease and to offer hope to desperate patients.
Right. Well, now I'm worried about the left eye, and my question is whether or not there is some process that's getting worse.
I can see those spots under certain light conditions.
Yes.
Most every night he makes phone calls to MD victims. They're not his patients, but those who have learned about him and his work. He returns every single call himself.
You can send me a bill for your
Oh, no.
all your phone calls and your effort.
That's
Certainly appreciated.
I've never billed a patient for this. It's not necessary.
Dr. D'Amato also has a very personal motivation driving his research. His dad suffers from macular degeneration. And because studies show that heredity increases the risk of the disease, one day he himself could have MD. In his laboratory, Dr. D'Amato directs several studies testing the effect of certain drugs on macular degeneration. He uses fertilized chicken eggs which resemble retinas damaged by MD. Currently, scientists have high hopes for a chemical that is illegal in the U.S. Thalidomide, once used as an anti-nausea drug, was banned after it was linked to birth defects in the 1950s.
We're hoping that something like this that causes a bad effect in one scenario could be used for a good purpose in another scenario.
So if you could find a pill that people could take in the early stage and stop blood vessel growth, that would be a tremendous advance.
While it would not cure macular degeneration, it would essentially eliminate much of the visual loss from the late forms of the disease.
Letters I know are tear-stained from people that wept when they wrote the letter to me. And those people have got to have help. And I just wish I could reach every one of the millions of people to help them.